Hormones and pharmaceutical drugs are not the only way to manage perimenopause and menopause symptoms like low libido, hot flashes, and sleep problems. The truth is that hypnosis is an underutilized option that can transform your health and your life. If you're new here, I'm Dr. Janet. I'm a board-certified obstetrician and gynecologist, a medical doctor, an intimate health coach, and hypnotherapist. I've been working with women for over 25 years, and I use hypnosis to help women over 40 navigate through perimenopause and menopause and feel alive and turned on again, and get their pleasure, their intimate lives, and their relationships back on track again. In this video, I'm going to explain what hypnosis is and how it works. Hypnosis is one of the oldest tools in psychotherapy in Western medicine. And its use was one of the first ways that doctors realized that a talking interaction could have therapeutic benefit. And even though it's been around for 250 years, it's still surprisingly underutilized. Now, before we jump into the details, make sure to subscribe to this channel and share this video with someone who you know needs this information. When you subscribe to this channel, it not only can help you change your life for the better, but it can also help other women to find this information and get the help that they need. Okay, so let's jump in. Now, I know about hypnosis in part because it's something that I used in my own health and wellness journey. But I've also used hypnosis and hypnotic techniques with my patients and clients over the past 25 years. Hypnosis has been around for a really long time. It's been used to treat anxiety, phobias, panic attacks, medical procedure anxiety, and even in the military surgeons have used hypnosis to combat stress reactions and surgical pain. It's been used to treat irritable bowel syndrome and other gut disorders. As an obstetrician gynecologist, I've used hypnotic technique during childbirth, and I found that using hypnosis to manage hot flashes and libido issues is particularly powerful in navigating perimenopause and menopause. So there are a lot of research-backed applications for hypnosis. There are MRI studies and EEG studies. These are studies using special tools to look at the brain and the brain activity. And these studies have shown us what's actually happening in the brain during hypnosis. And there are 3 distinct changes that happen in the brain when people are hypnotized. So first, the brain will turn down its alarm system. So when you hear a really loud sound and your attention shifts away to that loud sound, that's your salience network or your brain's alarm system telling you that it's important that you pay attention. The cingulate cortex is right in the middle of the brain, and the front part of it is your brain's alarm system. So you're turning down the activity in that part of the brain when you are hypnotized. And that's a good thing because it allows you to really concentrate and focus in your attention. And that's what hypnosis is. It is a state of relaxed, focused attention. So when you're focused in, anything else that doesn't need your attention at that time sort of blends and drifts into the background. The second thing that happens is that the mind-body connection becomes very strong. Very, very strong. There is hyperconnectivity. So really strong connection between the prefrontal cortex and the insula. Now, the prefrontal cortex is the part of the brain that is involved with executive function and control. This is the thinking, strategizing part of the brain. Insula is Latin for island. And the insula is a little island of tissue in the middle of the front part of the brain. And that part of the brain is the mind-body connector. It is a conduit that helps to connect the thinking part of your brain to your body. And this helps the brain to control the body. It also helps the brain to react to feeling sensations in the body. This is known as interoception. So you're hyper connected to your body because of this really enhanced mind-body connection. This connection helps your brain to interpret internal bodily signals like your heartbeat, hunger, thirst, pain, and temperature. And this is particularly important in understanding how hypnosis helps to regulate and improve things like libido and desire, hot flashes, and many of the other issues that women over 40 are often challenged with. During hypnosis, these areas become more connected, which means you're more tuned in to your body and its sensations. And then your brain is better at working with your body and those signals. The third thing that happens is that the part of your brain that is involved with your self-concept is also turned down. There's a part of your brain that is active when you're thinking about yourself, who you are, what you should be doing, or what other people think about you. This is called the default mode network. During hypnosis, this default mode or self-reflection network becomes less active. What that means is that you can sort of turn off your usual assumptions about yourself and about who you are and what you ought to be doing and try out being a different person with a new identity. This allows you to expand in new ways of thinking, new perspectives, and new ways of seeing yourself. And that's a big part of why hypnosis can be so powerful in making meaningful change. And this is where we can take on the new identity, the identity of the person that we want to be. So from the brain science point of view, hypnosis involves three main things. First is absorption, which means just very highly focused attention. Second is dissociation. And so what that means is that the things that normally would be in the forefront of our minds, in our conscious awareness, those move out of the center of our awareness and kind of fade into the background. And the third thing is cognitive flexibility, which is our ability to think of things in new ways. This used to be called suggestibility, but suggestibility kind of implies that you're helpless and vulnerable, that somehow you can be manipulated, which is not actually the case. Hypnosis is actually a partnership, so you work together with your hypnotherapist to make the change that you want to make. Now, we're all social creatures, and we all take in input from others and believe some of it. In hypnosis, you're really able to just try on a new system of believing or a new persona and just see what it feels like, including a new way of thinking about yourself and who you are. So that cognitive flexibility, being able to step out of the old mentality, mental habits, and way of thinking, and then experiment with new ones. That flexibility is crucial, and it's a very helpful part of the hypnotic experience. If you're a woman over 40 who is suffering with problems like hot flashes, low libido, sleep issues, intimacy problems, or just not feeling like yourself, and you're curious about hypnosis and how it can work for you, check the link in the description to learn how I help my clients wake up their pleasure and live their best lives using hypnosis. Thanks for watching, and I will see you soon.